The topic for today is intracranial pressure, ICP. ICP is not only a number, but it also reflects the cerebral survival of the patients. So, every medical healthcare person who is working in ICU should know how to recognize a raised ICP, how to manage it accordingly. So, understanding ICP from the definition, it is the pressure within the intracranial space in relative to atmosphere. Or I can also say the contents of the cranium that exerts pressure on the structure covering them. The contents are blood, CSF, and the brain tissue. So we have some values such as normal ICP in an adult is around 7 to 15 millimeter of mercury. In children, it is around 3 to 7 millimeter of mercury, and in term neonates it is around 1.5 to 6 millimeter of mercury. Now, understanding this, now the another term is Monroe-Kellie doctrine. It states that the content in the cranium are at in a fixed state of constant volume. As we all know, the cranium is a rigid vault. Now, the content in the cranium are brain tissue, blood volume, and cerebrospinal fluid. Now, this states that increase in any one component then this will lead to reduction in the volume of other components. According to this is the content in the cranium are at in a fixed state of constant volume. This means the cranial vault is fixed and it has the limited amount of the content, that is the brain tissue, blood volume and cerebrospinal fluid. If the volume of any one of the following, including blood tissue, brain tissue, blood volume and cerebrospinal fluid, it is compensated by reduction in the volume of the other. So now let's see the factors which affect the ICP. Okay, so now first is, let's talk about the brain tissue. Brain tissue can lead to increase in ICP in conditions like whenever there is mass effect. Mass effect includes, for example, whenever there is tumors, there is contusion, when there is hematoma like subdural hematoma, even epidural hematoma, or mass effect may include abscesses. Also, whenever brain tissue gets insulted, for example in traumatic brain injury, another is whenever the systemic conditions, I must say, like acute liver failure, and states like hypercarbia, this may affect the ICP. Now we'll talk about the second component, which is the flow of CSF, flow of cerebrospinal fluid. So बेसिकली सेरिब्रोस्पाइनल फ्लूइड का फ्लो दो तरीके से अफेक्ट कर सकता है हमारे आईसीपी को, या तो बहुत ज्यादा फ्लूइड बन रहा हो या फिर फ्लूइड के पाथवे में ऑब्स्ट्रक्शन आ गई हो. सो इफ फ्लो ऑफ सीएसएफ इज ऑब्स्ट्रक्टेड, then the conditions in which the flow of CSF is obstructed are hydrocephalus, second is infections, and other is meningeal diseases. Or whenever there is overproduction of CSF. Overproduction of CSF, which include, number one, as we all know, the CSF is formed in the choroid plexus. So any tumor in the choroid plexus will cause overproduction of CSF. For example, choroid plexus tumor, including papilloma, or carcinoma. Now, the third